My name is Dr. Hilda Nabiswa, and I'm a physician at Chogoria Mission Hospital, which is in Tharaka Nithi County in Kenya. I come to you today to talk about coronavirus and to educate members of our public, some of whom have been getting a lot of conflicting messages from the internet regarding this coronavirus. So what is coronavirus? Coronavirus is a family of viruses that has been known to cause common colds for many, many years. So this is not the first time that coronavirus has come about. It's been there for thousands of years. And it causes up to 20% of colds and flus. However, there are a couple of times where coronavirus has changed and gotten a new strain which creates a different kind of flu which is more severe and which requires more attention, global attention. The first time was when the SARS epidemic happened. The second time is when we had the MERS, M-E-R-S, and now this time, starting from 31st of December 2019, when we realized the new strain, which is known as the COVID-19 strain. This new strain is what is causing the big pandemic and the global, all the global changes that you're seeing happening in the recent past. So, what exactly happens when you get coronavirus? Now, contrary to what many people think, coronavirus, many people who get it are actually just okay. Many people report either no symptoms or very mild symptoms. And up to 85% of people get what we call mild disease. Mild disease is when you just have what you think is a common cold, flu. So you have cough, runny nose, a little bit of fever, but generally you feel okay, and it's something that you feel you can handle even from home. However, up to 10 to 11% of people develop something called severe disease. Now these are the people who actually get difficulty in breathing and they need help in terms of oxygen and other equipment in a hospital setup. Around 5% of patients, however, get what we call critical disease. Critical disease is now those people who are very sick from the disease, and these kind of people end up even sometimes needing ventilators to help them breathe because they get into something we call ARDS, which is basically your lungs fill up with fluid and they are not able to efficiently make you take up the oxygen that is getting into your system. And because of that, your oxygen saturation is very low and it can lead to a lot of complications. That is not the only complication of COVID-19, but it is the main cause of death in such patients. And so the question is, what do we do about it now that we know what coronavirus is? So first of all, it's important to realize that what makes COVID-19 different from the other viruses is that it is what we call much more transmissible, which means that there's a higher risk of you spreading this disease wherever you go, especially since we have just said most people don't have symptoms. So you will feel okay, you will get into the matatu to go to work, but unknowingly, as you cough and you spread your droplets, and the droplets remain in the air for quite a number of hours, and someone can actually get infected from that. And you can end up leaving that matatu, but you have also infected 2 people in that matatu. And those 2 people will go to a church, or they go to a burial, for example, and they end up infecting another 3 people each. And from there, it is just more and more people getting infected. Now, again we said, not very many people get sick, but the problem is the numbers. There are very many people getting sick. And that is the reason why, again, there are many people dying. So that even though it is not a very dangerous disease, in terms of it is not killing as many people as Ebola did, for example, but it is causing more infections. Many more people are getting infections and at a faster rate, and they don't have any symptoms, so you wouldn't know that so-and-so has COVID and so let me stay away from them. And that is why, my dear Kenyans, we have to practice what we are calling social distancing. What do we mean by social distancing? This just means that try as much as possible to stay away from people who you don't know whether they are infected or not. And that is the whole point, that you cannot tell. There is no label on anyone that will help you to identify whether they have the virus or not. So firstly, we have to try and make sure we keep our distance from people. So try as much as possible. Keep at least a meter away from people. Avoid crowds by all means. It's very disappointing to hear that up to now, clubs are still open, people are still partying, churches are still open, people are still going and filling the pews, and funerals are still taking place, and hundreds and thousands of mourners are gathering in these kind of events. What we are saying is we have to now make a change. I know that we have our own cultural beliefs as Africans, but in this particular case, these cultural beliefs will not help the spread of the virus. They will actually aid the spread of the virus. And so we need to make sure that we keep away from anything that will make us in contact with crowds. The other thing is we need to also do what we call regular hand washing. So make sure you're sanitizing your hands in any instance as many times as you possibly would wish to do. Carry a sanitizer. Before contacting any surface and even after contacting the surfaces, wash your hands. Sanitize your hands. Make sure they're clean and avoid touching your face, because guess what? The virus enters only through 4 areas on your face: your eyes, your nose, and your mouth. And so keeping your hands off that region will go at great deal in reducing the spread of these germs. The third thing is what I want to call social advocacy. There are many cases we are getting of patients who had actually traveled abroad and did not go into self-quarantine, and later on developed symptoms, and they are at risk. And they also put people at risk because they can get the disease from them. So if you know that there's someone around you who has traveled out and is not doing self-quarantine, guess what? You can stand up and you can talk about it. There's even a government hotline number, that is 988, that you can call, and you can report people. If you feel that your life is in danger, or the life of people around you is in danger, and you're trying to be as discreet as possible, you will remain anonymous. Your identity will not be revealed. And you will be able to save people around you and to reduce the burden of disease. And at the same time, if you know you have traveled out, please kindly self-quarantine. There is no reason why you should come from a country that has the disease and you still come here and go to attend burials and go to attend a church service and go to attend family gatherings. That is not right. My dear Kenyans, I think it is up to us, we owe ourselves and our generations that particular step where we say enough is enough. We have to change our common ways or beliefs or how we do things. We have to change our norms, and that is one of the ways we can do it. And as healthcare workers, we also need to be protected. There are many healthcare workers who do not feel ready to handle this task and who feel that they have not been trained, they are not ready. So we are appealing to the government, to the county governments, to ensure that all the healthcare workers are protected, that they have enough protective equipment to feel ready to tackle this disease. And not just that, we need to have more equipment. We need to make sure that our ICUs have enough ventilators, such that even if we ever get more cases, we know that we can take care of them in those particular settings. But right now, we are still not at a place where we can take care of very many patients who are in ICU. We don't have enough ICU beds, and therefore the main way of protecting ourselves from this pandemic is actually just prevention. Social distancing, hand washing, and being a social advocate by putting yourself in self-quarantine or making sure that someone you know who has come from outside and needs to be in self-quarantine is actually self-quarantined. And feel free to contact the government toll numbers. They have been posted everywhere. Contact them. Those numbers work. There are many national hotline numbers that have been put across, and there's one particular one which is actually functional, and it is free to use. And each county also has its own hotline number, and in Tharaka Nithi, ours is 1513. And this number is also functional, and it is ready for anyone who needs or requires to use it. Pamoja tuangamize corona. Thank you.